Okay, welcome to the series I'm calling Reflections for Pharmacy Leaders Advancing the Profession. It's my pleasure today to welcome Dr. Peter Vlasses with us. He served for over 20 years as the Executive Director of ACPE, which is the Accreditation Council for Pharmacy Education. And obviously lots of the things he might say that I won't go into all the details. Obviously his tenure was marked with the move to the entry-level PharmD, the establishment of the International Service Program, and lots of, it helped obviously also in the area of technician training, helping to form the Pharmacy Technician Accreditation Committee. So that's been great. He, prior to joining ACP, he had an academic career at the Philadelphia College of Pharmacy and Science and Jefferson Medical College in Philly, and where I believe he was extensively involved in clinical research. He is a founding member of ACCP, the American College of Clinical Pharmacy, and a past president of that organization as well. And I think the significance, since this is a history course, and why I thought it was great to obtain his insights, not only for his distinguished leadership career, but also because in 1983, he wrote a letter to the FDA to request that PharmDs be recognized as principal investigators. So that was a major sort of opening up the doors, we'll say, for PharmDs as in terms of research. So with that, I'll stop my introduction and let me go into the speaker view. All right, well, welcome. And we'll start off with the first question. We'd like to learn more about your journey to in terms of your career and recognition as a leader. And often I paraphrase that to say, there may have been key events that were turning points in your career and people who may have influenced you in your journey. So I'll turn it over to you.
Harry, thank you for the kind introduction and for the invitation to participate in your course. I view myself as one of the early pioneers in the clinical pharmacy movement. It was the early 70s. I was getting, in 1971, I got my BS degree. And at that point in time, people were saying, I don't think they're going to pay pharmacists just to distribute drugs into the future, and that we need to evolve and be a part of the healthcare team. That really struck a chord with me at the time. I went on to do a residency PharmD combination and graduated in 1973. And at that time, people were telling me it was a big mistake what I had done, that the PharmD would never be recognized in academia. It would never amount to anything. You wouldn't be able to do research. And that was kind of a challenge that, when people say you can't do something, then sometimes that motivates you to say, well, I can do something, or we can do something. So as you mentioned, I started out at Ohio State and then at the Philadelphia College of Pharmacy, and eventually wound up on the faculty of a medical school in Philadelphia. The original issue was the medical school committee didn't want to accept the PharmD as an acceptable degree. But I had great support at the time from the physician that hired me into a position that was a physician position. And his name was Roger Ferguson. And he went to bat for me. He got the chairman of medicine to do this. The pharmacologists were trying to block it. And eventually, I was recognized as a research assistant and then associate professor in the medical school. And the pharmacology people who blocked me several years later in the name of collaboration gave me a cross appointment in their department. So it was an interesting journey. Sometimes you have to take chances to get ahead. I think a lot of this started for me with some great mentors. John Gans was the head of the PharmD program at the time. It was pretty new. Dan Hassar basically was my faculty advisor coming through the program. Both of these people wound up getting the Remington Award as the highest honor in pharmacy, and they were tremendous influences in what I consider my calling. That basically, you say, well, did you want a job? Yeah, of course I wanted a job. Did you want a career? Yeah, of course I wanted a career. But that's not why I did what I did or wound up doing what I did. I wound up being embodied with a calling to be a change agent in the profession of pharmacy towards this vision, both in terms of practice, education, research, and trying to move PharmD from the exception to the rule, from clinical practice, from the exception to being pervasive change in the profession. And that's ultimately what got me to, as you said, we did a lot of research at Jefferson. That got me an ability to come join a hospital alliance in Chicago, the University Health System Consortium at the time. Again, I spent 10 years there doing what I called macro clinical pharmacy and multi-center projects that allowed pharmacists from various hospital settings to collaborate and collect information on new drug products and how they were being used and whether guidelines were being appropriately used. But what ultimately, and there I interacted with the person that hired me was Alexander Schmidt, again, a physician who was looking for a physician partner in a new enterprise at UHC. But he hired me, and then he was a tremendous mentor, and also David Zills from the University of Wisconsin. And I was there 10 years, and at the time was just the time that Daniel Nona, who had been the executive director of ACPE for 25 years, was retiring, and they were looking for somebody to head up ACPE. And I was encouraged by a good friend on the board to apply. I didn't think I had a chance. The interview went well. I was surprised to be selected. I was honored to be selected. And for the last 20 years, right before my retirement last year, I really viewed myself as, they say when you have the job you're supposed to be in, you never work another day in your life. And that's the way I felt about my 20 years at ACPE. I woke up every day trying to figure out how could we get better. We moved from the BS under my leadership to the all PharmD. We had to make sure all the schools got to address all the standards in the right time frame. They did. We grew, we changed the standards, we added to the standards. We introduced more experiential education than the original standards. We developed standardized with AACP, the American Association of Colleges of Pharmacy. We developed standardized surveys for graduating students, faculty, preceptors, and alumni. We changed a lot of the accreditation process, tried to facilitate it, made it easier, expanded the time frame from 6-year terms to 8-year terms, and developed a lot of ongoing data that we could evaluate programs annually on their enrollment, their NAPLEX pass rate, their MPJE pass rates, and other things that were obviously measures of quality. And again, I think the key thing is to identify as a student, what is your calling? And you're going to have to talk to people, you're going to have to listen, you're going to have to turn inward and see what drives you and what kind of agent do you want to be for the profession. And when you do, then go after it and seek mentors, and then pay it forward in the future by being a mentor to others as you grow in your career.
Very good. Thank you. And some words of advice already. And I'll ask that again, but thank you for those. So the other question I asked is, what do you think people will be saying about you in terms of your legacy in 20 years? And the way to look at this, another way of looking at it is, what is probably of your various contribution, what are you most proud of that really has helped advance the profession? I mean, we can obviously indirectly from what you said, but I'd like to hear your reflections on that.
Well, you mentioned when I was president of ACCP that I wrote the FDA to clarify the role of the pharmacist's ability to be a principal investigator on clinical research studies, human clinical research studies. And we took a chance at the time because they could have very easily said no. But, you know, I'm pleased that over the years, people have told me how much they've used, because we published the letter and let everybody know about it, and how new physicians or somebody walking into a drug company don't know about it. And their first issue is, well, pharmacists can't do this.
Right.
And then somebody pulls out the letter and they go, oh, I guess pharmacists can do this. So that's been tremendously gratifying that we were, you know, that simple act was able to influence colleagues who were doing clinical research and still is influencing. We did a lot of clinical research at Jefferson. We published on some drugs that are widely used today. We had early access to ACE inhibitors and HMG-CoA reductase inhibitors and erythropoietin and other drugs. And a lot of that publication got used in applications in clinical therapy. Now, of course, over time, clinical therapy changes. We are doing a whole bunch of different things with monoclonal antibodies and pharmacogenomics and other things like that. But at the time, it was, along with other colleagues who were doing similar things, a big movement forward for clinical pharmacy to have a research base and to be involved at that level. But I think for me, the move from the BS to the PharmD that I was able to be involved with at ACPE was something that I think 20 years from now, they'll say, what happened in, you know, 2000, which was the year that new entry-level students had to enter a PharmD program to be in an accredited program. And so we saw the closing out of the BS program. We saw the post-BS PharmD, which helped people in the transition if they wanted to do that. And again, the evolution of, I would say, interprofessional education as an important component of the PharmD education was something that evolved over the 20 years of my time to the point where it's now a full standard and a requirement. And the other thing, I don't know where the future is, but we were able to create a group called the Health Professions Accreditors Collaborative, which involved organizing 25 different accreditors in the healthcare field to be focused on how do we do better interprofessional education. We co-developed a guidelines for quality interprofessional education in the health professions. The document was released in early 2019. And if you look at month-by-month hits on our website of the HPAC website, we're still being hit about 1,500 times a month where people are coming when the HVAC website used to get 15
Mm,
hits a month.
mm.
Now we're, at a high point, we had close to 3,500 hits, people looking at this guidance document and trying to use it to collaboratively look at how to do better interprofessional education.
Very good. Excellent. And again, you've already given us some words of advice for students, but any other words of advice in their journey, especially as they develop as leader, and obviously leader often, as you say, agents of change, influencing um, people to make changes to advance the profession.
So I mentioned, being mentored, that's really important. The other thing I think I started out talking a little bit about this is to take some risks.
Mm,
And not all risk will pay off.
mm,
In other words, the University Health System Consortium position that I took, I probably never worked harder and achieved less in a 10-year period.
mm,
But it was amazing to me how much I learned during that experience that prepared me for the ACPE directorship in terms of managing money, managing people, doing things. And at the time, I said, I'm not doing enough. And little did I know that that prepared me for um, the next part of my professional career that I really, like I said, it was the high point of my career and the ability to serve the profession in that capacity.
excellent. Excellent. Very good. Very good. So the final question has to do when we're going to be studying the decade of the 2020s. I think one of the points that will be highlighted will be the COVID-19 pandemic. That will be an event that occurred in this decade, and I think it will be viewed as an event that was a turning point in our profession as well, like other events in history. So to maybe further expound on that, opportunities for the profession and what's your insights on that when we're studying this decade? We know it's already had tremendous, there's lots of things happening. We're living it today, but as we study history, how do you think that's going to read for us?
Well, from an education standpoint, COVID has forced people to look harder at distance education. And it's forced people to consider synchronous and asynchronous education, to consider how to not only short-term get through a curriculum that we had to and use technology, but more importantly, allow it to evolve where there's better pedagogy that can come out of distance education. The whole interprofessional education field may be benefited by the fact that we've had to do it on the internet right now, but it allows people to get together and problem solve and understand each other's roles and communicate effectively. Sometimes when face-to-face meetings or scheduling may be a problem, I think we're finding that some of this is now being facilitated by the use of technology. And from a profession standpoint, from a practice standpoint, I think that in my time, I've seen an unbelievable evolution of hospital and health system-based pharmacy practice. And where it used to be isolated pockets of excellence, now it's pervasive change where almost everywhere, well-prepared pharmacists are doing important things that are recognized as way beyond the distribution of the product. And I think the COVID is another example where, staying on top of important drug supplies that are going to be needed for patients on ventilators and throwing up the red flag early and making sure that people are aware and working with manufacturers and getting approvals, quickly to make sure that patients that need those drugs have them. On the other hand, in my time, and I would say as I retired, something that I would hope had gotten further along was the evolution of our our pharmacy practice in the community setting, specifically in the retail chain community practice arena. But I've been encouraged, even in the last couple of weeks, at things that are happening, that pharmacists in the community are stepping up to try and help patients and the public health system in, first of all, being allowed to test for the COVID-19 virus. And I believe, and I would hope, that over time people would understand that they would be in a great position to not only test, but trace, to see when somebody is positive, how far back could you figure out who else they interacted with, and how could that be an important change. So I think immunizations in general have been an important step forward for community practice. And our education program has trained people on graduation to be able to do this. And I think once COVID-19 vaccine or vaccines show up, that I think, again, the pharmacists are going to be positioned extremely well to do this. So point of care testing to identify the virus or antibodies as they develop further, I think will, again, continue to show the populations out there of healthcare financiers and others that community practice has a lot to offer patient care and patient care outcomes and costs. And I hope that this would be another way of putting a big light on the opportunities pharmacists, given those opportunities, can produce. And hopefully that would be a chapter that says we opened up more understanding and improvement of clinical pharmacy in the community as a result of the COVID-19 virus.
Very good. Excellent. Excellent. Well, I appreciate. Thank you very much for your time, and I appreciate that. Thank you.